Thank you for your interest in the use of a consultation service following pharmacogenomic testing in psychiatry. This poster is authored by Dr. Daniel Dowd and Dr. David Kraus. Both are employed by Genomind at the time of this presentation. There are dozens of medications available to mental health prescribers for the treatment of psychiatric disorders. These medications can vary significantly by tolerability, side effect profiles, and drug-drug as well as drug-gene interactions. Pharmacogenomic assays are becoming more widely used. However, many providers seek additional education about the validity and utility of these tests. This poster describes a professional consultation service that was administered for 6,401 tests from October 2018 through August 2020. Here you see the full poster, but let's look at each section in more detail. Consults were provided following test results for Genomind Professional PGx, a commercial pharmacogenetic assay of 9 pharmacokinetic and 15 pharmacodynamic genes. Consultations are performed by experts in psychopharmacology with PharmD or PhD credentials. The Genomind assay consists of multiple report pages and over 120 treatment options. All clinicians have access to the report as well as software that helps manage drug-drug, drug-gene, and drug-environmental interactions. Consults consist of a report review, drug-drug-gene interaction assessment, and treatment algorithm evaluation, all done via Zoom teleconferencing. Consults are scheduled for 30 minutes with an average consult duration of 21 minutes. Data captured during consults include relevant symptoms, symptom severity via CGI-S scale, and past and current medications and comorbidities. Consults are rated via a Likert scale ranging from not helpful to extremely helpful. To avoid real-time bias, a separate web-based survey was conducted to confirm the consultation ratings. 77% of patients in the cohort were described as moderately or markedly ill via the Clinical Global Impression Severity Scale. Consults can be scheduled several ways. This pie chart describes the frequency of the different consult scheduling methods. 51% were scheduled through an interactive clinician portal, 29% through a customer service representative, and 20% through a quick access on-demand hotline. 94% of consults were rated as very or extremely helpful. In the validation survey of 128 providers, 96% of consults received a score of very or extremely helpful. The most common genes discussed during consults were SLC6A4, MTHFR, CACNO1C, COMT, and BDNF. This finding suggests that providers were more comfortable understanding pharmacokinetic genes, but needed additional input interpreting pharmacodynamic genes. Other interesting medication results are listed in subsequent columns. The Genomind Drug Interaction Guide is used during video conferences to assist with complex drug regimens. This is a real-time, online gene-drug interaction guide in which prescribers can explore potential pharmacokinetic drug interactions of hundreds of drugs. GDIG is pre-populated with the patient's pharmacokinetic genotype. In the example shown here, the beta blocker metoprolol is flagged with a gene-drug-drug interaction, while a drug from the same class is not. The goal is to provide a composite view of drug-gene, drug-drug, and drug-environment interactions. Gene-drug and drug-drug interactions are plentiful in psychiatric patients. The FDA's table of pharmacogenomic biomarkers in drug labeling lists dozens of such psychiatric medications. Even expert psychopharmacologists may have difficulty recalling all drug-drug pharmacokinetic interactions, and genetic testing may reveal additional potential interactions. Consultation with experts in PGx provides additional useful information that has the potential to improve outcomes and decrease healthcare resource utilization.